Mr. Smith. My name is Nora, and I'm going to be working with you today. How are you? Great. Well, the doctor has ordered an NG tube placement. Has he explained that procedure to you? Okay, great. Do you have any questions about it at all? Okay, all right. Well, before we get started, could I please have you repeat your full name and date of birth for me? Okay, great. I'll just check this. Okay. Now what I'd like to do is just check the computer and verify the order. If that's all right. Okay. And he's ordered it. Now looking at your past medical and surgical history, it shows that you've never had any nasal injury or surgeries. No? Okay. Great, great. All right, so if you just give me 1 second and we will get going here. Just wash my hands again. Okay. You're doing all right? Great. Okay, so the first thing I want to do is we'll just get a pad across your shoulders here in case that you would get sick. Okay. There we go. Okay. And then I'm also going to give you an emesis basin and some tissues. Okay. I would also at this time like to just check your nose to make sure that there's no blockage or anything that you're breathing. Okay, we can get the tube in place. So if I close off an air, would you please take a breath? Breathe through. Great. Okay. Other side. Thank you. Now I'm going to just take a look. We'll make sure that there's no irritation. Polyps. Great. They look great. Okay. So what I'm going to do next, Mr. Smith, is measure the tubing. We'll measure the distance that it needs to go into your tummy. Just get this lubrication open here. Okay. And the tube here. There we go. Okay. What we're going to do is just measure. Alrighty. Okay. Okay. Just gonna block that in. Alrighty. And I'm gonna lubricate it. Now what I'm gonna do is insert it about 3 to 4 inches. Okay, then I'm gonna give you a little break. When I give you a little break, then I'm going to ask you to take a drink of water, and we'll continue from there. Okay? Are you ready to go? Okay. If I could just have you look forward, okay? We'll get started. Ready? Okay, here we go. Okay, alrighty. Now, just give you a minute here. Doing all right? Okay. Now I'd like you to take the cup and I'd like you to take a drink, and I'd like you to keep drinking. And as you swallow, I'm going to continue to insert the tube. Okay? All right. You ready? Okay. Swallow. Swallow. Keep going. You're doing great. Swallow. 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 Doing a great job there, Mr. Smith. Keep going. Swallow. Yep. Okay. Doing great. And it's going. Keep swallowing. Yep. Almost. Alrighty. Got it. Okay. So just secure this. Okay. Doing all right. Alrighty. And we'll just get that on there. Now I'd like to do a couple checks. First, I would like to just put a little air in there and see if I can hear the air going, and then that would tell me if it's in your tummy. And I'd also like to do a pH test, which would also tell me that it's there. We'll just double check. Okay. Pull back a little bit of the contents out here, and then we will check that just to make sure. Okay. Okay. And it looks like we are in the tummy because we're at 2, so we're good there. Okay. So now I'm going to secure this. Okay. I'm also going to tape it up just a bit. There we go. There's a little bit of room here. Okay. We'll pin it up here. Now I want to put some air in here to get that tube off of your tummy, okay? Okay, great. Now we'll just hook up the tubing and we'll get that suction pump going. Okay. Oh, I did that a little backwards. We're gonna hook up the tubing here. We got the pump going. Now I'm going to get that tube off of your tummy. Just put a little air in there. Okay. Great. Okay. Oh, let's just stop this. All right. Looks good. You comfortable? Okay. All right. So now I'm going to just clean up my supplies, okay? And then I'm going to go on with my video. Mr. Smith, you seem to be having a little bit of problem with the tubing. It seems like it's plugged. Tummy's a little distended. Okay. First thing I'd like to do is just check and make sure that that tube is where it's supposed to be. So we'll shut the pump off. Okay. And I'm going to try to get some air in there. I'll disconnect it here. Okay. See if I can get any out. No, it doesn't want to come out either, does it? Alright, so I'm just going to get some water. Okay, let's see if we can get it opened up for you. Okay. There we go. Great. Now we are going to hook this suction back up. Okay, we'll turn it back on. Now I'm going to take a tube here and we'll put a little more air in there and get that tube off of your tummy again. There we go. Great. Doing all right? Wonderful. Okay. Now I'm leaving, coming back. Hi, Mr. Smith. The doctor has ordered me to take your tubing out. So I'm going to change my gloves, of course. He's ordered me today to take the tube out. You don't need it anymore. So at this time, if it's okay, I just take a little listen to your tummy. Great. Now I'd also like to just make sure that our tube is in place, so we'll just double check here again. Shut this pump off. Okay. Okay. guess we didn't have to do this. All right, so now we're going to irrigate it. And drop 20 cc's here. And 20 cc's of air. Okay. We're just going to irrigate this, okay? Great. Okay, you doing all right? Okay. Well, now at this time, I'm just going to disconnect this, and then I would like you to take a deep breath and hold it as I remove the tubing, okay? So I'll tell you when we're ready. Okay, are you ready? Take a deep breath and hold. Okay, here we go. Hold. Doing all right? Great. Okay. Wonderful. And any pain at all, Mr. Smith? No. Okay. That ends my validation.